Welcome in, y'all. Kurt here with Dr. Jake. Guys, I'm very excited to introduce you to Dr. Jake. If you have not met him yet, Dr. Jake is the lead physician at our newly formed Transformation Clinic. So he's bringing a lot of expertise to our practice here, particularly as it relates to health and longevity, and taking the traditional medical model and sort of turning it on its head in terms of customized patient and client care, and just a really well-rounded approach to health. So we've put together this presentation. We were chatting and thinking, hey, what are 3 index numbers that we really think people should know about? And guys, if it was up to me titling this thing, I would have said the 3 indexes, but thankfully we have Jake with 7 years of medical school and residency to correct me and tell me that this actually should be the 3 indices. So just know we're talking 3 key index numbers here that we're going to chat about in different areas of health too. I think that's really important to consider. So Jake, first one up, we're going to talk about the insulin resistance index. So I'm going to turn this over to you and just tell us a little bit more about that.
Yeah, thank you, Kurt. So this insulin resistance index is a blood test. It's a probability score that gives you your likelihood of being insulin resistant. Now, I'm sure we've all heard of insulin, but what is it exactly? Well, it's a hormone, which means it's a communication molecule. It allows the pancreas to communicate to the rest of the body, but in particular the muscles, the liver, and fat or adipose tissue, that we're in the fed state, that we've eaten recently and that energy is in a surplus. So this is an anabolic signal. It instructs these organs or tissues to take up extra glucose out of the blood and store it for later use, either as glycogen or as fat. Now, unfortunately, these organs can become resistant to insulin's effects, requiring louder and louder signals to communicate insulin's effect. Now, this is a condition that ultimately can lead to type 2 diabetes. Now, this progression from high insulin but normal glucose to full-fledged type 2 diabetes can take several years to develop.
So a question we get a lot is, all right, well, I come in, I've got my A1C, I've got my fasting glucose from just my traditional lab panel. They're normal. So am I in the clear here as far as insulin resistance?
Unfortunately not. So yeah, the hemoglobin A1C and the fasting plasma glucose are the typical standard screening labs for type 2 diabetes. But these can remain normal until sort of the later stages of this progression. So if you're relying solely on these 2, common labs, you can be missing several years of this, the early stages of this dysfunction.
There's a lot out there about insulin resistance, continuous glucose monitoring, all that stuff is real popular right now. But at the core of it, why is this so important? I mean, why do we care?
I think this early identification of insulin resistance, long before even your hemoglobin A1C or fasting plasma glucose is abnormal, is crucial. All the chronic diseases that we associate with type 2 diabetes, all of the other organs and tissues that it damages, these changes aren't waiting until you hit that threshold of type 2 diabetes to start. These begin when insulin resistance begins. So the earlier you know that there's a problem, that's just years of lead time, prime time for you to intervene, make a change, prevent these long-term consequences.
Coming from a lab, where we test body composition often, what's the role between body composition and insulin resistance? Either, does body comp lead to insulin resistance, or does insulin resistance impact body comp? What's your take on that?
Absolutely. So certainly obesity, excess adipose tissue, and dysfunction, metabolic dysfunction in that adipose tissue is the primary kickoff for this process of insulin resistance. Now, unfortunately, I think you also find yourself in a vicious cycle. Once insulin resistance begins, it seems like it's harder and harder to lose weight. I think mechanistically, biochemically, metabolically, we don't necessarily understand why that's true, but anecdotally, it does seem to be true. And just speaking to patients and talking about their experiences. Again, I think this is probably due to that generalized dysfunction in the adipose tissue. Probably as well as some resistance to the appetite-suppressing effects both of insulin and other communication molecules from fat tissue, things like leptin, adiponectin, things like that.
Yeah, it's easy to forget that our fats, it's not just there, right? It's a pretty active organ within our bodies.
It's super complex. It's metabolic and hormonally active. Definitely not inert at all.
So let's talk next about a very different type of fat and transition over to our next index, which is the omega-3 index. Tell us a little bit more about that and why we should care about it.
Yeah, so omega-3s are a type of fatty acids, key fatty acids. This omega-3 index is looking at some of those key omega-3s in our cell membranes. This is just a finger prick blood test, and the result is expressed as a percent. Now, the two omega-3s that we're focusing on with this omega-3 index are EPA and DHA. Now, these are the ones kind of commonly found in fatty fish or fish oil supplements. And so there's been a lot of buzz around fish oil supplements for many years now. Kurt, can you kind of talk to us about how to decipher the fish oil supplement labels and kind of tell what we're getting?
Yeah, having worked on the retail supplement side for a number of years, it's one of those things where the label on the front or the front of our bottle doesn't always tell the full story, right? Because a lot of times we might see fish oil 5,000 on the front of the bottle, but what does that really mean in terms of EPA and DHA, which again, these are the key long chain omega-3s that we're after when it comes to this index and when it comes to all the research. So what I usually do is take a label, like this one we have here, and first I'll start off by just identifying the total fish oil. I'm not as concerned about this number, but just to get an idea, all right, well, what's the total amount of fish oil? And if you're somebody who's vegan, vegetarian, we could, sub algae oil in for this. There are plant-based sources of EPA, DHA as well. Now, from there, we'll look at total omega-3s. Now, this particular product has kind of a unique label in that it splits it all out. So basically, we're looking at the 50 grams of other omega-3s plus the 250 milligrams of EPA, DHA, giving us 300 milligrams total omega-3s. And then what we really care about, which is that EPA, DHA value. In this particular product, is at 250 milligrams, or about 25% of the total oil. Now, EPA DHA could be 50%, could be 75% of your total fish oil. And so generally, when we're looking at supplementing to improve our omega-3 index, we're going to say, hey, higher EPA DHA value is going to be more efficient. Not to say that you couldn't do it with a lower supplement, you'd just be taking more gels. Now, we look at omega-3 index, and I think there's a lot of knowledge about fish oil and maybe that they're important. But let's quantify really what's going on here. I mean, what pieces are affected by omega-3 supplementation?
Yeah, I think the reason I like this omega-3 index is it provides valuable information that can help you decide if you could benefit from supplementation, and if so, how much. And I think one of the primary and most convincing benefits is the reduced risk of cardiovascular disease and cardiovascular events like heart attacks and strokes. Now, this is probably in some part conveyed by reduced triglyceride levels. Omega-3s have been shown to do that for many years now. Probably above and beyond that, this benefit is conveyed just by a potent anti-inflammatory effect of these molecules. I think another promising benefit, maybe slightly less well established by the research so far, but is a maintenance of cognitive health and reduced risk of neurodegenerative diseases like dementia. Now, this again is likely also due to that anti-inflammatory effect of these omega-3s. Another reason why I hear a lot of people supplementing with fish oils and omega-3s is relief of joint pain and inflammation. Certainly has been shown to be helpful in patients with arthritis, even inflammatory autoimmune types of arthritis. And then I think another key reason why I like supplementing with omega-3s is it boosts muscle protein synthesis. Omega-3 supplementation has been shown to increase muscle mass and strength, and even to blunt loss of muscle or atrophy during periods of immobilization.
Yeah, I mean, when you look at all those benefits, from a health longevity standpoint, it's almost amazing that omega-3s are not more widely a part of somebody's physical, this particular omega-3 index score, because I think there's a lot of, valuable insights there when it relates to things like, aging well or improving quality of life down the road. But as with anything, it's probably not just as simple as the benefits. Are there things we need to consider with omega-3 supplementation, and why we might just not want to supplement willy-nilly without having this index score?
Definitely. So as with anything, there are risks, side effects, things to consider with omega-3s. The one that I find probably most compelling is a clinically small but statistically significant risk of a heart arrhythmia called atrial fibrillation. Now, this was noticed in some very large trials where they were administering very high doses of omega-3s to patients, notably without any prior measurement of their omega-3 levels. So they were not checking omega-3 indexes in these patients prior to prescribing these high-dose omega-3s. Other things to consider, although I think slightly less compelling, while fish oils do reduce your triglyceride levels, higher doses have been associated with small increases actually in LDL cholesterol. Whether or not this is clinically important or significant is not clear. I think it's likely offset by the other cardiovascular benefit, the reduced inflammation, the anti-inflammatory effects, and the reduction in triglycerides. But something probably worth paying attention to if you are supplementing with fish oils, particularly at higher doses. And then lastly, something I hear a lot of fear and concern about with omega-3 supplementation is a concern for increased cancer risk. Some of the early observational studies just asking patients, do you supplement with omega-3s, and then looking to see what sort of health outcomes they had, did raise some concern that there might be some increased risk for cancer. Now they've obviously done further investigation trying to definitively determine if there is a link between the two. And so far, none of these studies have actually been able to link omega-3 supplementation with cancer. But I'm sure there'll be continued investigation in these, and it's an area worth paying attention to as that research unfolds. At this point in time, it's not something that I think should cause someone to shy away from omega-3s, though.
Yeah, sounds like a lot of potential value here. We just got to continue to monitor our levels. And also, I think going from, it sounds like going from a low threshold to a moderate threshold is going to be extremely beneficial, and then whether we go from a moderate to high threshold on omega-3 index, that may depend on a person's goals and needs and all that.
Absolutely, yeah. And I think anytime you can use, well-validated data points to help you guide decisions, around your health and wellness, I think you should always take that opportunity.
Yeah. So let's jump ahead to our last index here. And this index is called the Fat-Free Mass Index, or FFMI for short. Now, the Fat-Free Mass Index starts at its core with a body composition measurement. So sort of our bread and butter here at the lab. And at its simplest level with body composition, we're basically breaking the body apart into two compartments. On one side we have our body fat, and then on the other side we have our fat-free tissue, or all non-fat tissue in the body, which is predominantly driven by our muscle mass, our skeletal mass, our organ mass, etc. Now, in our industry, we have a lot of metrics that focus on body fat, but we don't often really get a good indicator of how much fat-free mass somebody has and how we can quantify that piece. So we're really going to focus in on this side of the equation when we talk fat-free mass index. Now, as far as calculating this number, what we'll do is we'll take your fat-free mass, convert it over to kilograms, and then we'll divide it by your height. And we use meters squared just to create that index number. Now, once we get this value, part of the reason we divide by height is we're not going to compare somebody, if you're 5'9", for example, we're not going to compare you to somebody who's 4'11" or somebody who's 6'6", because we know that individuals with these different body structures are going to have very different bone and organ mass. So ultimately what we're doing is we're trying to flesh out the muscle mass piece and how much muscle mass does somebody have, again, relative to their frame. So we're going to simply define FFMI, I would say an indicator, not a perfect number, but an indicator of how much muscle mass an individual has relative to their frame. And I always love just the Urban Dictionary look at it, which is how swole someone is. We're not concerned about fat. We just want to know how much muscle mass do they have. And again, is that in a high, moderate, or low category? So why is this important? Well, it's going to help us answer some key questions. These are 4 of my favorites. So we get a lot of questions about the BMI chart. We have people in the military, that have to meet certain weight thresholds, or, people always ask, hey, is this, I heard this ideal weight given to me. Is it really accurate? And so first we want to know, are these ideal weights from the BMI chart applicable to me and my body type? Secondly, am I at higher risk for negative consequences associated with age-related muscle loss? So right in this, we're trying to figure out, are people in a low FFMI category to begin with, as we start to see a natural decline in muscle loss, lean tissue over time, how is that going to impact somebody in terms of quality of life, etc.? Thirdly, should I focus on increasing muscle mass as part of my strategy for body composition change? And then lastly, am I approaching the upper limit of FFMI to where significant increases in muscle mass may not be possible? So those are 4 things we look at a lot with clients and try to flesh out with the FFMI. Now let's give some numbers to this, give some context to this. So usually, once you have an accurate body composition test, the easiest thing to do is just Google FFMI calculator, right? Just with it, like with anything else. You'll get a number of different online calculators that'll pop up. You can throw your body composition data into that calculator, and it'll spit out an FFMI value. You can also use the equation I showed a couple slides ago. But ultimately, what we're after here, and you'll see this is one of the larger studies that I've seen in regards to FFMI and percentiles, is the low. Okay, so the low FFMI generally will mean somebody with lower muscle mass relative to frame. For men, usually those numbers are 17 and below. For women, those numbers are 14 and below. And we want to be really cognizant in this group that about considering quality of life issues down the road, whether that's mobility, etc. And also considering that we want to understand this person's composition, because if they have low muscle mass and a normal weight, they might also have more body fat or adipose tissue than we would expect. And so that's very important to understand. And on the flip side, we also want to understand the high too. So people with a lot more lean tissue or a lot more muscle mass relative to frame, because a lot of times these people, men over 21 or women over 18 score on the FFMI, those people are going to get penalized by the BMI chart, and the ideal weights that it's spitting out may not be very accurate indicators of health for these individuals. So those are things to consider with the FFMI. I think once you have an accurate composition test, it's pretty easy to plug in the points and then actually take a look at this data, because it's not something we talk about very often. So Jake, man, great being with you on this presentation. You guys have questions on any of these metrics, feel free to shoot us an email here at the lab, and we'll be glad to chat more about these.
Yeah, absolutely. Thanks, Kurt.